Hosted in conjunction with Chris Media, the CEO interview series allows investors to hear directly from the CEOs leading the companies featured on Wholesale Investor. Enjoy the interview and reach out via the details in the description.
Hi and welcome to another Crisp Q&A. Today I'm joined by the CEO of Peak Medical, Hayley Saddington. Thank you for joining me, Hayley.
Thanks, Sydney. Great to be here. Thanks for having me.
Absolutely. Now, Hayley, how about a bit of an executive summary for Peak Medical just to get us started today?
Yeah, sure. Peak is a startup coming into the Australian market first. Peak Medical creates pre- and post-op rehabilitation treatments. So we cover a range of disorders, including osteoarthritis and total knee replacement. And what we do is we deliver daily physiotherapy, mental care and education into the home at 90% less cost than the current care model today.
That's a strong USP to start with, and we'll dig deeper into that. So before we do, let's keep that on the burner and talk about what motivated the inspiration behind the venture. What was a problem that was identified by the founding team and yourself?
Yeah, absolutely. Look, unfortunately, we can't scale healthcare. We have these massive growing populations, and we have the public patients who don't get the level of care and time that they need to prepare best for surgery. We've got to limit the amount of care we're giving them because the cost simply to implement physios in the home or physios in the clinic, psychologists, nurses, surgeons, that whole care system, which is human capital or heavily focused on actually delivering it with people, is so expensive. So yeah, unfortunately, there's a massive limit on what we can provide people. That creates massive discrepancy. So we see people in the public getting limited services and poorer outcomes post-surgically. And then we look at the private sector. The private patients are paying their premiums because the health providers, the private health funds, don't have a scalable, low-cost solution that's effective to give them. So we're really looking at changing or addressing scalability issues, making sure we can serve the whole population as we grow, but changing the experience that people have in healthcare. Really, really important.
Okay, so let's combine those two answers now because there's some very exciting talking points there. Let's combine those two answers and talk about what makes this solution so effective and how it's navigating the competition at the moment.
Yeah. What makes our solution really effective is that we are a pure software play. So we're able to mitigate the risks and costs that are involved with hardware and going through a pure human capital model. And that makes us able to reach every single person in their home from day one when they're complaining about the knee pain, if that's the condition we're going to be talking about, right through to when they're in full recovery at home. So we really have this incredible model through technology that enables everyone to be looked after from day one right through. There's no limit on the care. And again, we're able to do that because we use some really incredible technology to do so.
What's been the, we'll start with this. What's the clinical feedback? I mean, obviously very important when it comes to this stuff is feedback from the trusted advisors, which happen to be the medical professionals in these communities. Have you had any clinical feedback to date? And if so, can you allude to what that was, what the sentiment was?
Yeah, I've sat with over 1,200 patients to really understand the pain points that we're solving here. And they want to be heard. They want to go into appointments with their surgeon and have all their questions answered. They want to be able to access, absolute optimal care packages. But again, they can't afford it. And if you're on that public health system, you don't get a choice there. That's what you get. So we spent a lot of time with the patients and the private patients as well to understand what they want. And that's what we've designed in. The stakeholders that we are very closely associated with is surgeons, physiotherapists. I'm a physio by trade, so I really understand what we need as well. But as a physio, you can expect more data insights, a higher level of care for your patients, better post-op outcomes because they're getting daily care. They'll connect in with the physio as well, but on a less frequent manner. So we're really optimizing their patients with them. Yeah. Surgeons get greater data insights as well. They get the patient delivered to them at the right time and in optimal condition. So we look at increasing physical activity for patients before they get into surgery. We look at preparing them from an education level, what to expect. We decrease fear. We decrease anxiety that's often associated with going to surgery. And that makes for better post-op outcomes. So we offer that to our stakeholders. In addition, the health providers, so the government and the private health insurers, really need low-cost solutions that they can trust in, that are evidence-based, that are delivered by clinical teams, which is us. We're designing in as clinical teams that are truly effective. So that's our offering.
Excellent. Now, I guess another key factor, you touched on some exciting numbers there with the 12,000 patients that you've spoken to or have alluded to their main benefit they're deriving from this product. But I'd love to know what other milestones you as a venture have achieved to date, just so those who are watching can understand the journey on a deeper level. What are some key milestones, some key highlights that you'd love to tell our audience?
Yeah, thanks, Sydney. So always great to touch on where you've been and what you're doing and how you even got here, because it's a tremendous journey already. So obviously we've identified a really strong solution to a problem, and having deeply worked in this field, we know it is a problem that we can solve. We have validated this with GPs, physiotherapists, patients. We have worked with Flinders University under a scholarship there to develop a full market report to validate exactly what we're doing with our customers. We've also worked in with Flinders University and gaining engineer hours with them to develop our computer vision system out. So that enables us to mimic the physio in the home. So it's incredible technology in one half of our platform that is being built out. We won the Innovation District Challenge as a COVID reduction technology. So we're able to keep people at home versus getting them into hospital. We also won a scholarship and award through Western Sydney University as well. So we've got surgeons committed to the trial. We have a 400 patient trial set over the next 12 months to really deeply get our first customers, first users, and derive the evidence they're ready to scale. So there are a couple of things we've achieved, and just recently, last week, we brought in an incredible team member who is our CTO and now co-founder, building out the rest of the platform.
Exciting stuff. So we've got a good grasp of where you've been, who you are right now, and where you're going, which is what we need to know as prospective investors in this space. But I'd love to know, and for the audience, what is Peak Medical looking for at the moment? Who do they want to speak to as a parting message to our audience today, Hayley?
Peak Medical really is an opportunity to come in at a starting level and think of us as someone like Babylon Health, currently worth $4 billion. That's certainly our trajectory and where we aim to go, because we aim to help a large group of the population. So if anyone's looking for that opportunity to come in at an early stage, that's it, and to help affect the health system, absolutely come in with us. We're really looking for high net worths and angels. I think we're most aligned with you at this stage. People who are also associated with perhaps health providers or have a network there, I think would be incredibly well aligned. So we are, raising up to 1 million. We do have some of that capital in already. We have grants in the pipeline to equate another 800,000 to really scale over this next 12 months. So we're looking for people who want to make change, impact, want to have better experiences themselves in the health system, and really care about sustainable healthcare.
Okay, Well, for those who are interested in reaching out to Peak Medical and speaking to a representative from the team, we will have the details in the description at the side of the screen. And Hayley, thank you so much for joining me today. Congratulations on the achievements to date and best of luck for the anticipated milestones in the future.
Excellent. Thanks, Sydney. Great to be here.
Thanks, Hayley.